Reciprocal temporal rocker technique. So this technique is to balance CSF and should be done after cranial work or after spinal adjustment, never before. If a patient has blanching on the face or in a spinal area after your treatment previously, don't do it. So the contact is full thenar on full mastoid. Here's the mastoid process, full thenoid and full mastoid. Instruct the patient when they breathe in, deep breaths, to move the feet towards the head, dorsiflex, breathe in, handing, and clench the fists, and breathe out, extend the fist, point the toes down. Breathe in, clench the fist, pull the toes up, breathe out, dorsiflex, open the fingers. So they do that 3 times. At the same time, okay, thanks Andy. At the same time, back to your full thenar contact on the mastoid. So he's going to do that 3 times. Do it 3 times, Andy. Right, now what you're feeling for is temporal movement. Can you feel temporal movement? Relax now. There's temporal movement and the weight. You'll feel if one temporal pushes more against your thenar, does it feel blocked? So if you find both are moving well, that's it, you're finished. It's balanced. If, however, we'll say the right side is a bit fixed, feels heavier, then this is the adjustment. So full thenar, full mastoid. So because it's the right side, it's blocked. The left hand stabilizes. And Andy's going to breathe again 3 times. And you wing the elbow out. Breathe out, push the elbow back. Breathe in, wing the elbow out. And again. Okay. So after the test, we found the right temporal bone feels a bit blocked. It feels a bit heavy. So with the left hand, full thenar to full mastoid, we're going to stabilize, hold that still. And then he's going to breathe again, and you wing the elbow out. And bring the elbow towards yourself. And again, wing the elbow right out. Once more. That's fine. Okay, and relax. So, normally 3 repetitions is enough. But all the time, have a look at the glabella, the superciliary arches, around the mouth to see if you can see blanching. If you see blanching in any of those areas, stop. The temporal reciprocating technique is very similar, it's just quicker. And this time you have your hands interlaced underneath the head, thenars to mastoid again, full thenar to mastoid, but your fingers interlaced. So the patient breathes and you move your thenar back and down, and they breathe out, forward and up. So this side is the blocked side. This side is the free side, this side's moving, there's nothing wrong with this side, so you're just stabilising it. This side again is the side that's stuck. So you move, breathe in, back and down, forwards and up. Back and down, forwards and up. Now I'm exaggerating the movement of the thenar there so you can see it, but in reality it's a more subtle movement. So you do that the same and look for blanching again. Once you see blanching, then you can stop. Ventricular compression, ventricular pull. So these techniques stimulate CSF and they empty the fourth ventricle. And they're useful for any hypo condition, congestion, inflammation, insomnia, migraine. So this technique, however, is contraindicated with drug or alcohol intoxication. That's for the patient and you. And the contact point is the occipitomastoid suture is here, and you're going to contact just inside there with the fingers interlaced like this. So the patient, as before, inhales, dorsiflexes the feet, does the hands, and you, with the contact here, squeeze the thenars together, and you're going to draw the occipital squama superior and posterior. So you're going to draw it superior and posterior with your hands like this. So it's a very subtle movement like this. Okay, and as you do that, you'll feel the occiput recoil anterior, inferior. You're going superior, anterior. It's a very subtle movement. It's a very subtle movement and not hard. So patient breathes in, breathe Andy. Yeah. You're squeezing in, squamous superior, posterior, and again. Keep breathing, so you're drawing it like this. Like this. And then you let go, the fingers let go as he breathes out. And breathe in, like this, breathe out, relax the fingers. You do that 3 times until you see blanching. And breathe, just once. So the third cycle, Andy's going to breathe out, but I'm holding my hands in the inhalation position. And I hold that, compressing, posterior, inferior, and holding, hold, and relax, Andy. Okay? Okay, so ventricular bulb, the next technique, is just quicker when you haven't got so much time. So the contacts are the same. On inhale, breathe in, Andy, you compress the thenos, and when you breathe out, you let the pressure go. Inhale, squeeze in, breathe out, let go. It's as simple as that. You can repeat up to a minute. If you feel one side's a bit more weighted than the other, you could put a bit more pressure on the weighted side compared to the other. And look for blanching again, and if you see blanching, stop. Sphenobasilar symphysis technique. So the sphenobasilar is where the sphenoid and the occiput join, and this part of your skull is ossified in cartilage. So the technique, you have your index finger on the sphenoid wing, next finger on the temporal, ring finger on the parietal, and little finger on the occiput, like this. So to produce motion, you're going to check when you breathe in or breathe out if you can feel a pulse bilateral in the sphenoid. So the index finger, the sphenoid wings, you're feeling a pulse. And if there's a full pulse both sides, that's fine. The thumbs are crossed above the bregma like this. They're not touching the bregma. So if it's an inhalation problem, so there's no pulse inhalation, with your fingers you're going to pull back and down. So I'm exaggerating it like this, but it's a subtle movement. So you're going to pull back and down as the breathe in, feel for the pulses. If the pulses come back, that's it. If not, repeat. If the problem, there's no pulse on exhalation, then you're going to go forwards and up. So the fingers are subtly moving this way, like this. This is touching here, this doesn't move. So the fingers are moving like this. And you do that, you'd repeat on 3 respirations and feel here, see there's a bilateral pulse. So the fingers, index fingers on the sphenoid wings, your thumbs are crossed above the bregma but not touching the bregma. This finger on the temporal squama, this finger on the parietal eminence is here, and if you can, little finger over the occiput. So the impatient, so we'll assume I can't feel a pulse bilaterally, and we'll say there's no pulse this side. So on inhalation, so this is an inhalation fault, so the patient breathes in and holds the breath in, and I pull the fingers on the squama and on the parietal. So I'm going back and down as I hold the breath in. Hold it, hold it, hold it, and let go. And check the pulses again. If they're fine, that's it. If not, repeat. If the pulses are absent on exhalation, they still hold the breath in, breathe in and hold, but this time you're going down and forwards. So you're going opposite direction. This is still touching the sphenoid wing. Hold it, hold it, hold it, and let go. So get instruction to breathe in, breathe out, and this time I can feel a pulse on exhalation as well as inhalation. That's it.